Good day everyone, my name is Christine Sumawang, a student nurse from Tarlac State University from BSM 1P, and for today I will be performing a performance evaluation checklist about the donning a sterile gown and gloves, a closed method. So first thing that we need to do is we need to know the purposes of our procedure. So the first purpose is to enable us to work in a close to the sterile field and to handle sterile objects freely. Next is to protect our clients from becoming contaminated by microorganisms on the nurse's hand, on the nurse's arms, and the nurse's clothing. So following the nursing process, we will now proceed to our assessment phase. So first thing that we need to do is we need to review the client's record or orders to determine exactly what procedures will be performed that requires sterile gloves. Next is to check the client's record and ask about latex allergies. We need to use non-latex gloves whenever possible. Now we will proceed to our planning phase. So first thing that we need to do, we need to think through the procedure and we need to plan which step is needed to be completed before applying the gloves. Next is we need to determine additional supplies needed for the procedure, and also we need to remember that we need to have an extra pair of gloves available. Next is we will be assembling our equipment. We do need to have a sterile package containing sterile gowns and sterile gloves. And now we will proceed to our implementation phase. So first thing that we need to do is for our preparation, we need to ensure the sterility of our gloves and our gown. So to check the sterility of both the gown and the gloves, we need to look for the expiration date of both the gloves and the gown. And prior to the performing procedure, we will be introducing ourselves to our patient and verify the patient's identity. Next is to explain what we're going to do and explain also why is it necessary, and also we need to assess whether the patient has the ability to assist with our procedure. So here is an example. Good day, ma'am. My name is Christine Sumawang, a student nurse from Tarlac State University. And for today, I will be performing a donning of sterile gown and gloves in a closed method. So it is very necessary to protect our patients from becoming contaminated by microorganisms on the nurse's hands, arms, and clothing. Okay. So for our next step, we will be performing hand hygiene and observe other infection control procedures. And for our next step, we need to provide some privacy to our patient by closing the curtains around bed or closing the doors to room if possible. And after that, we will proceed to our application of the sterile gown or applying our sterile gown. And to do that, we will need to open the package of sterile gown, sterile gloves, and we need to remove the outer wrapper from the sterile gloves and leave the gloves in their inner sterile wrap on the sterile field or sterile surface. And for our next step, we need to unwrap the sterile gown from the pack. So I have already unpacked this sterile gown. We will now proceed again to the performing of proper hand hygiene. And for our next step, we need to put on now our sterile gloves. And to do that, we need to grasp the sterile gown on its crease near the neck. And we need to hold it away from our body. And also, we need to permit it to unfold freely without touching anything, including the uniform. For our next step, we need to put our hands into the shoulders of the gown. And for our next step, we need to work our arms pathways into the sleeves. And while also we need to remember to not touch anything or the outside of the gown. And for our next step, we need to keep um, our hands on the sleeve above waist level. And for our next step, we need to work our arms down the sleeves and proximal to the edge of the cuff. And for our next step, for our 14th step, we need to have a co-worker to tie uh, our gown by grasping the necktie of the gown, and also to remember not to touch the outside of the gown. So the coworker must pull the neckties of the gown um, upward to cover the neckline of our uniform in front and back. Now we will proceed to the coworker in tying the ties of the necktie. Okay. Now we will proceed to the donning of sterile gloves and the close method. So first thing that we need to do is we need to open the sterile wrapper containing the sterile gloves. We need to open the sterile glove wrapper while the hands are still covered by our sleeves. And for our next step, we need to put the glove on the non-dominant hand. With the dominant hand, we need to pick the opposite glove with our thumb and index finger, handling it through the sleeves. And for our next step, we need to lay the glove on the opposite gown cuff, thumb side down, and with the glove opening pointed towards the fingers, and we need to position the dominant hand palm upward inside the sleeve. So next step is we need to use the non-dominant hand to grasp the cuff of the glove through the gown cuff and firmly anchor it. After that, with the dominant hand working through its sleeves, we need to grasp the upper side of the glove cuff and we need to stretch it over the cuff of the gown. Next, we need to pull the sleeves up to draw the cuff over the wrist as you extend the fingers of the non-dominant hand into the gloves. And for our next step, we need to put the glove on our dominant hand. First thing that we need to do is we need to place the fingers of our glove hand under the cuff of the remaining glove, and we need to place the glove over the cuff on the second sleeve. Also, we need to extend the fingers into the gloves as you pull the glove over the cuff. And that would be all for the donning of sterile gloves in the closed method. And now we will proceed to the completion of gowning. Next, we will proceed to the completion of gowning. So first thing that we need to do is we need to have a co-worker hold the waist of your gown using the sterile gloves or the sterile forceps or drape. We need to have the co-worker to take the two ties in each of the gown and tie them at the back of our gown, making sure that your uniform or our uniform is completely covered. And for our next step, when worn, sterile gowns should be considered sterile in front of us or in front from the waist to the shoulder. The sleeves should be considered sterile from the 2 inches above the elbow to the cuff, since the arms of the scrub person must move across a sterile field. And for our next step, we need to remember that there is no special technique for removing the sterile attire. If they are soiled, we need to remove them by turning them inside out. And if appropriate, we need to document that the sterile technique was used in this performance of the procedure. And for our evaluation, we need to conduct any follow-ups indicated during our care of the client, and we need to ensure that adequate numbers and types of sterile supplies are available for the next healthcare provider. And that would be all for the performance of the donning of sterile gown and gloves in a closed method. Thank you.